Hello, my name is Dr. Isang, and I'm a cardiologist here in Knoxville, Tennessee. And thank you for giving me this opportunity to discuss concepts regarding the heart, kidney disease, and different types of risk factors such as hypertension, diabetes, high cholesterol. So today's topic is going to be kidney disease and the heart. Before I start, some of the keywords that I wanted to mention in case anyone gets confused, if I use it interchangeably to you guys, so you guys are able to know what I'm talking about. First one being coronary artery disease. This is the plaque that is found in or around the arteries. I can also abbreviate it as CAD. The second one is myocardial infarction, or MI. This is a heart attack. This is the downstream effects of poorly controlled hypertension, hyperlipidemia, diabetes, etc. And the third being CKD, or chronic kidney disease. This is decreased function of the kidneys, which we use GFR, and I'll discuss that briefly in the upcoming slides. So the first question is, why is this important? Well, around 33% of adults are at risk for kidney disease. Unfortunately, African Americans are 3 times more likely compared to other populations, other genders, other ethnic groups. Risk factors for this includes hypertension, obesity, diabetes, heart disease itself, but more importantly, the things that are not discussed enough is being aware and having access to healthcare. So this slide is a little bit simple, a little bit busy at the same time, but these are the 3 main factors that, prevents us from meeting our guidelines, meeting what we are expected in regards to appropriate healthcare, appropriate management of our comorbidities or conditions that can lead to bad things happening, which I will discuss further at the end of the lecture. So a little bit of the introduction. What is chronic kidney disease? To keep it simple, CKD, or chronic kidney disease, is defined as the presence of kidney damage or decreased kidney function. We measure this as GFR, or glomerular filtration rate. To differentiate between chronic kidney disease and acute kidney disease, you need to have this decrease for at least 3 months or more, versus acute kidney disease is less than 3 months. Treatments for both are similar, controlling risk factors. Acute versus chronic, one of the biggest differentiating is if you catch acute early enough, you could potentially cure it, you can potentially reverse it. Versus chronic, this has been ongoing for several months, for some people several decades. So the option of potentially preventing or reversing or curing may not be there anymore, but now we're focused on preventing it from worsening or keeping it at bay. So someone has chronic kidney disease. One of the biggest issues is that in the early stages of it, you don't really have any symptoms at all. It is not until people have had it for several months, several years, decades, that they finally come in to be seen and treated. Unfortunately, that may be a little bit too late once again to reverse it. But the symptoms we see at that time is tiredness, leg swelling, decreased appetite for foods, and cramps. So one of the things to know is that chronic kidney disease is extremely common. More than 1 in 7, or 15% of adults will have chronic kidney disease. To break it down even further, 9 in 10 adults who have it don't know that they have chronic kidney disease at all. 2 in 5 adults don't know that they have severe form of it. Severe meaning that they are possibly approaching the point where they need to be on dialysis. So chronic kidney disease by age, sex, and ethnicity. Age-wise, the most common people that we see are people who are older than 65. But when it comes to race and ethnicity, we're finding that people of color, specifically African Americans and Hispanics, are at greater risk compared to other races. Now we're switching over to heart disease. This picture shows that the more dense the color is, the higher prevalence there is, the higher possibility, the higher numbers there are of people who have heart disease. And if you can see, the southeast has the deeper colors, meaning that there is more heart disease in the southeast compared to other areas in the United States. So why is this important? Heart disease is the leading cause of death for men, women, and most racial groups and ethnic groups in the United States. One person dies every 34 seconds. This means about up to 700,000 people in the United States died from heart disease in 2020, equating about 1 in every 5 deaths, and it is extremely expensive. Multiple hundreds of billions of dollars is spent in healthcare, and that number only continues to rise. Once again, in 2020, 1 in 5 or 2 in 10 deaths happened in coronary artery disease in people less than the age 65. So break it down a little bit further. 600,000 people had their first heart attack. 200,000 had a recurrent heart attack. What makes heart disease even more frustrating and more difficult to treat is about 1 in 5, 20% of individuals have it that are silent, meaning that they were not aware of it. There are a lot of risk factors for this, including gender. More commonly, we see it in females compared to men, diabetes, and unfortunately, chronic kidney disease. So who is at risk? One of the big three: hypertension, high cholesterol, and smoking. But also want to pay attention to people who have diabetes, are obese, poor diet, physical inactivity, and excess alcohol use. So why is this important? Chronic kidney disease and heart disease. Having chronic kidney disease only increases your chances of having heart disease and poor outcomes. Poor outcomes meaning having your first event, having bad outcomes from your first event, dying from a heart attack, dying from procedures to treat the heart attack, such as heart catheterizations, increased risk of dying from having bypass surgery. But the most important thing, once again, is that a lot of people who have chronic kidney disease have heart disease and don't even know it. They account for that 1 in 5, meaning that they're having silent heart attacks, and they don't know it until things get worse because they haven't been seen, they haven't been treated appropriately, they haven't been given a chance to give their heart the ability to recover. So this is an old study around 2004 showing that chronic kidney disease is a risk factor for cardiovascular disease. Biggest thing I wanted you guys to take from this study is that CKD is a risk factor for all-cause mortality and cardiovascular disease, and unfortunately is more pronounced in the Black community compared to the white community. Once again, chronic kidney disease, you see it more commonly in people who are age 65 or greater, and more commonly in people of color, specifically African Americans. Now we're looking at the risk factors. Unfortunately, these risk factors, there is a disparity with it too, meaning that African Americans, Hispanics, people of color are more likely to have these risk factors, and by having these risk factors can lead to having worsening kidney disease, worsening heart disease, worsening outcomes overall, increased risk of bad things happening, morbidity, or dying, mortality. But not all things are bad. One of the things I can say is that since the 1990s, we have seen a steady decline in heart disease, outcomes. But unfortunately, there's still a significant disparity, meaning that African Americans are still at higher risk and have higher probability of bad things happening compared to other race and ethnic groups. So switching over to heart disease, I am a cardiologist, so this is what I see a lot of time. The most common complaint is chest pain, and specifically chest pain in this area is worrisome. The chest pain that gets worse with exertion, chest pain that gets better with rest, or a medication called nitroglycerin. If you have this, you really want to be seen by a primary care provider, or even taking it a step above that and going to the emergency department to be further evaluated. Once again, women, diabetics, people with chronic kidney disease can have what's called atypical symptoms, meaning that they don't have the classic findings of chest pain here, worse with exertion, better with rest. It doesn't mean that their problems is not serious. It just means that we as physicians, we as primary care providers have to have a heightened sense of awareness, but also continue to work these individuals up, maybe not in the emergency department, but work them up outpatient with doing an echo, stress test, etc. When in doubt, get checked out. So having chest pain, what other things should you be looking out for to see your primary care provider, to see a physician, to see a healthcare provider? Any type of new chest pain, any type of new shortness of breath, new fatigue, Unfortunately, with the pandemic, a lot of people were brushing off their symptoms because they thought they were just out of shape. They haven't worked out in a long time, when in reality, they were having atherosclerosis, the process that leads to having a heart attack or bad heart disease outcomes. Also, not feeling themselves, feeling quote unquote off. This can be heart disease. This can be a lot of different things. Don't wait. Go and see your primary care provider. So what can we do? There's a lot of different treatment outcomes, both medical and non-medical. And I want to try to focus on the non-medical, not using medications outcomes first. The first thing we want to do is check out blood pressure. Hypertension, if you guys don't know, is known as the silent killer for a main reason. You don't have any symptoms. So this is one of the reasons why we really want you to be seen by your primary care provider, so we can check your blood pressure. Ideally, you want it to be 120/80, 130/80, nothing too far off from that, because the higher that number is, the harder your heart has to work, and over time can lead to things like stroke, heart attack, heart failure, dementia, increased use of medical care, which can be expensive. Secondly, probably the most important thing is your nutrition. Wanting to stay away from fast foods, fatty foods, foods that can lead to high cholesterol, and focus on healthier options, your greens, your if you want to eat meats, your lean meats, you want fish, chicken, things that you can cook on your own and not necessarily go to a fast food restaurant, because they're packed with a lot of things that are basically bad for your body that can increase your risk of having heart disease. One of the best ways to remember is something called a DASH diet or Mediterranean diet. Those diets focus less on less meat, focus on fruits, fish, vegetables, and nuts. Number two, you want to exercise. Ideally, you want to do 30 to 50 minutes a day for 3 to 5 sessions a week. But more importantly, you want to be consistent. If you can only allot 10 to 15 minutes daily, then do 10 to 15 minutes daily with watching what you're eating and being consistent. It's a no-brainer. The more salt you use, the higher your blood pressure is, the more you are at risk of having heart disease. So decrease the amount of salt content as much as possible. And stress is one of the biggest factors also, because the more stressed you are, the more likely you are to make bad decisions, which can lead to not working out, which can lead to poor nutrition, etc. So finding ways to decrease the amount of stress, whether it's taking a nap, exercising, journaling, yoga, but more importantly now, seeking care from a professional, whether it's a psychologist or psychiatrist, to be able to have someone to talk to about reasons as to why you're stressed. And just as important as seeing your primary care provider, a lot of times we've done all these things to improve our health, to improve our blood pressure, watching what we're eating, exercising, decreasing stress, but we're still not able to control our blood pressure well. This is where your primary care provider, your doctor, will be able to help by prescribing medication, but more importantly, looking up other reasons as to why you are having high blood pressure. There's a lot of individuals who have something called secondary hypertension, which is blood pressure due to something else. So things like issues with the thyroid, issues with the kidney itself, issues with the adrenal gland. If those are not addressed, they can lead to poorly controlled hypertension. And not only that, no matter how many medications you're taking, the blood pressure is still difficult to control. In the United States, one of the biggest things that I've found is that a lot of people have difficult to control blood pressures due to having undiagnosed or undertreated sleep apnea. So this picture, once again, wanted to describe what's going on here. If you look at the bottom left, person is looking at their watch time. Unfortunately, people wait too long before they're seen by their primary care provider. Before they're seen by their physician, before they're seen in the emergency department. Sometimes this can be months, weeks, decades, but being seen quickly, we can treat it and potentially prevent it, potentially cure it, reverse it, versus if you wait too long, we're not talking about prevention anymore. We're talking about treatment to prevent it from getting worse, also known as, I can't think of it right now. In the top right, there's a big question mark. A lot of people just don't know. So if you don't know, you're not going to get treated. This is why it's important to see your medical provider, at least on an annual basis, to be able to be seen and treated appropriately. And in the one in the middle, social media, unfortunately, can be a great thing, but can be a a horrible thing too, because of people expressing their frustrations with their medical professions, with their medical doctors, how they were mistreated, and this can lead to them not seeking treatment, not seeking help when they really need to. So be very mindful of who you're listening to. Go and see your doctor at least once a year. Go and get checked out at least once a year, so that we can make sure that if you have any risk factors that can lead to heart disease, that can lead to kidney disease, aka hypertension, we treat it now to prevent something bad from happening in the future. So we're at this point of treatment, cure versus prevention. We're trying our best to, treat you guys, but we also want to start thinking about prevention, not just for you, but for your friends and your family. Start talking to them about things to look out for. Start talking to them about seeing their doctor at least once a year to get your annual checkups to prevent something bad from happening. Ideally, in the future, we want to eliminate treatment and just try to focus on prevention. But this is an active process from me talking to you guys, and from you guys sharing information to your family and loved ones. My name is Dr. Isang. Thank you very much for giving me this opportunity. I hope that you guys found any benefit from this. Thank you.